Did you know your health is your greatest asset and the key to lasting success? Welcome to Tiger Health Assessment's Optimal Health Weekly Show, where we help driven professionals, CEOs, and entrepreneurs like you take control of your health and unlock peak performance. Hosted by the founder of Tiger Health Assessment, Steve Adams, this podcast is your guide to optimal health through the power of functional medicine and preventative concierge care. Each week, we'll bring you a dynamic mix of expert interviews and solo episodes with actionable insights tailored to your busy, high-achieving lifestyle. Together, we'll explore strategies to enhance your health, optimize your performance, and redefine what success looks like. Subscribe now, and together we'll enhance your health, optimize your performance, and redefine success.
Well, welcome back to the Future of Personalized Medicine Summit. I'm Steve Adams from Tiger Medical with Dr. Hans Vink. Dr. Vink, let me give you a little bit of background on him. He has been a tenured professor 30 plus years at the University of Amsterdam and the University of Maastricht in the Netherlands. And he's also the person credited in the literature for discovering a new organ called the Glycocalyx that we're going to talk a little bit about today. But most importantly, what he's going to talk about is how it gets damaged, but then how can you restore it, and what are the implications of that? Dr. Vink, welcome to the summit.
Well, thank you, Steve. My pleasure to be here.
Yeah, and just so you know, Dr. Vink is also the Chief Science Officer of the Glycocalyx Research Institute and Genesis Health Sciences. Full disclosure, I'm involved with this company as well as an executive, so we are partners and we work together. But this is next generation science, and we want to make sure everyone here gets to hear about it. And I want to make this really important statement. If you're here to optimize your health and enhance the odds of greater longevity, what we're going to talk about today should be a foundational aspect of everybody who's on that journey. So, Dr. Vink, can you maybe give us a couple minutes? I mean, it can be 5 minutes, whatever, just your story about how you became the world's most renowned researcher in this area of glycocalyx health and discovering the glycocalyx, and maybe what the science path was for you.
Sure, Steve, I'll try to put it in a few minutes. So originally I was trained as a physicist in the late 1980s. And as part of my physicist training, I did some rotations in different workplaces. And one of them was in the Academic Medical Center in Amsterdam. And they had a department called Medical Physics. And that's a mixture of all kinds of people working there. Physicists, engineers, but also clinicians, physiologists. And it happened when the moment I entered that lab to do a tour, one person that I started working with, Peter Wieringa, he just returned from the US, and he had made some wonderful video recordings of living tissues, small blood vessels, showing how red blood cells flow through these small capillaries one at a time. And seeing these videos, and hearing his story, it became apparent that there was this big discussion ongoing. Why are there so few red blood cells in these capillaries when you look at them live? And there was this wild hypothesis that maybe there's something inside these small blood vessels that's invisible, transparent, nobody knows, that might occupy like 2/3 or 3/4 of the volume of the vascular system, and nobody knows about it. So that triggered my curiosity, starting making many of these videos, and then work with my future mentor, Brian Dooling, in Charlottesville, Virginia. And with him, we realized really there is something inside these small blood vessels. There's a gel inside small blood vessels that's stuck to the wall. It's a protective gel called glycocalyx. And then we've developed some techniques to image glycocalyx, really showing that more than 50% of the volume of these small blood vessels is filled with this protective gel. And then we figured out that when you break down this gel, and it's damaged when you're exposed to all the classical risk factors. So if you smoke, or you don't watch your diet, or you get older, or you don't control your glucose or insulin levels, or your blood pressure levels, then the first things to be damaged is this protective glycocalyx gel. And then when the gel is damaged, you lose a lot of your vascular protective functions. So you produce less nitric oxide. So your vessels will constrict and your blood pressure will go up. Your vessel wall surface becomes very sticky because the gel is a lubricant, and when it's gone, everything will stick. Red blood cells, blood platelets for coagulation, but also inflammatory cells will stick and cause inflammation. And also the vessel wall becomes very leaky. So fluids will leak. You get edema, swollen hands and ankles. You'll lose your proteins that you'll see in your urine at early onset of kidney disease, for instance. But also larger molecules like cholesterol. The bad cholesterol will easily leak in your vessel wall when your glycocalyx protective gel is damaged, triggering the onset of atherosclerosis. So fooling around for a few decades in experimental settings, it became obvious that this gel is not only real, it's very thick, and also very important to keep your blood vessels healthy. And that triggered the next step to develop a medical device called GlycoCheck to be able to measure if your glycocalyx and your microvascular is in good shape also in humans, in healthy humans and in patients. And so that kept me busy for the last 15 years or so.
Wow, that's impressive. And so talk a little bit about the device. Like it's had 15 years of research really validating that it is an accurate method of measuring the current condition of your microvascular health. Is that correct?
That's absolutely correct. So, when we made that switch from just research settings, big microscope in experimental research models, to a medical device to be used in humans, we used a small handheld video microscope. And you can just put it in your mouth and you have live imaging how red blood cells flow through capillaries. And one thing that we learned in the earlier studies, if you look closely how red cells flow through capillary blood vessels, and especially when they get close to the surface of the blood vessel wall, you would think they would touch the wall because the red blood cells need to be squeezed and deformed into these small tubes that don't really fit. So these are 5 micron diameter vessels, and the red blood cells are about 7 microns, so they're squeezed. But when you look closely, they don't touch the wall. They don't even get close to the wall. There's this thick glycocalyx compartment in between the red blood cells in the center of the vessel and the luminal surface of the endothelial cells that make up the wall of these microvessels. So in healthy vessels, the red cells all stay nicely in the center of the vessel and don't touch the vessel wall surface because the glycocalyx is in between. So one thing we realized, as soon as glycocalyx gets damaged by any risk factor that we can think of, then the glycocalyx become mechanically less stable, becomes highly permeable. There's holes in glycocalyx, and then the red cells will just punch little holes when they flow through the vessels and get very close to the endothelium. So by measuring the distance of the red cells to the endothelium and how they try to move into that protective zone of glycocalyx, that's turns out to be a very accurate measure of measuring glycocalyx damage. And of course, in the past, we did validate, if that method is accurate. So comparing with, electron microscopy or atomic force microscopy, all kinds of other imaging methods that are very accurate to see if the functional measurement of glycocalyx with the red blood cells, if that correlates well with the other measures, and it does. But no, the best proof is in all the clinical studies that we have been doing. So people have been using the GlycoCheck device in over like 200 different academic medical centers now, in all kinds of different clinical studies. And time over time, the GlycoCheck system underlines that breakdown of your glycocalyx is one of the earliest steps of vascular damage in a wide variety of patient groups.
So I think you were going to share some slides where you could show, the company has developed a nutraceutical that mimics the processes in the body that actually can restore the glycocalyx, which is really the hope in this message today. It's not all bad news. Like you can actually do something about it. And I'll say right here, my scores have improved over the last 3 months since I started adding that. I was already doing the lifestyle factors really well. And so the Revasca has been just that last piece that has kind of helped it all come together and improve both of my measures.
Yeah, let me show you a little bit about that Revasca supplement.
this is key. People that are watching, just listen here because he's going to explain the underlying mechanisms that are in this supplement that actually correct the problem we've been talking about.
So before we switch to the supplement on the left, you see the GlycoCheck system. So it's a little handheld microscope and a computer and the software to automatically measure the health of your glycocalyx and how many small capillaries you have and all those parameters. And the Revasca is a third generation supplement that Bob Long and I worked on over the last 15 years also to optimize the therapeutic targeting, really to improve the health of the glycocalyx. And Revasca has 6 main components that all have different functions to help you improve the health of your glycocalyx. So one of the most important one is a seaweed called fucoidan. And this seaweed, well, if you look at the molecular structure of this seaweed, turns out to be a hybrid of 2 known polysaccharides, heparan sulfate and chondroitin sulfate. And turns out those are the main polysaccharides that are just growing in your own natural glycocalyx. So we've done a lot of testing and it mimics perfectly the properties of your own glycocalyx polysaccharides. So what happens is when your glycocalyx is compromised and there's holes in your glycocalyx, any of the fucoidins circulating in your blood will instantly associate with your vessel wall surface, filling up those holes and rebuilding a couple of micron thick, mechanically stable new glycocalyx coating that will prevent even activated leukocytes from sticking to the wall. So it really is really very fast in repairing the holes. Another exciting property of that fucoidin is because it's so similar to the endogenous heparan sulfate glycosaminoglycans, it also is a very good inhibitor of an enzyme that's targeted against those heparan sulfates. So the enzyme is heparinase. And the heparinase enzyme, when you have the fucoidin present, will bind to the fucoidin and doesn't target your own glycocalyx. So it deactivates that enzyme that is responsible for a lot of the breakdown of glycocalyx in different patient groups. Well, similarly as the fucoidin, there's another polysaccharide called hyaluronic acid. Hyaluronic acid actually is very similar in structure as heparan sulfate, but we do know that especially the high molecular weight hyaluronic acid molecules form a big part of the volume of glycocalyx. So hyaluronic acid molecules are huge and they can bind up to 1,000 times their own weight in water. So basically the glycocalyx is polysaccharides, but only 1% of the volume of glycocalyx is polysaccharides and 99% is water bound to proteins that bind to these polysaccharides. So hyaluronin is very important for the volume and the water content of your glycocalyx. Another important polysaccharide that we added in this last generation supplement is what we rebranded Vascaman, which is a high concentration of the ace-mannan polysaccharide. And ace-mannan polysaccharide comes from the aloe vera plant, and that has been used for thousands of years to treat skin issues, burn wounds. That turns out to be a very powerful immune modulator. So really optimizes your immune system to whenever your immune system needs to kick in to be ready to go and really help you to improve much faster from all kinds of immune challenges. So those are all 3 polysaccharides, 3 different kinds.
Mm-hmm.
And another important property of glycocalyx is to help your vascular wall to produce more nitric oxide. And a good balance between nitric oxide production, but also the scavenging of oxygen radicals locally produced that deactivate the nitric oxide is also a very important property of your glycocalyx. So to help your glycocalyx to deactivate oxygen radicals, we added natural sources for 2 enzymes, superoxide dismutase and catalase. So those bind within the polysaccharides of glycocalyx are very close to your vessel wall, and they capture and deactivate locally produced oxygen radicals, so thereby preventing breakdown of your glycocalyx. And then to further help your vascular wall to produce more nitric oxide, we added two other components, L-citrulline. L-citrulline is used by your endothelial cells to produce more nitric oxide, so the substrate for nitric oxide production.
Mhm.
And also polyphenols from the skin of apples and grapes that we find in a compound called phinitrox really help also to produce more nitric oxide with your glycocalyx. So all these combined, they're all very powerful, but then they have synergistic effects on each other. Because if you have more polysaccharides, it will produce also more nitric oxide because your endothelium uses glycocalyx to sense blood flow and produce nitric oxide. But the nitric oxide is more effective if you can scavenge oxygen radicals. And then with the phinitrox, you even have more powerful production of nitric oxide. Also, all together, they really help and form a very powerful mix to improve the health of your vascular wall.
And, I had you do this because so many supplements are pushed. I wanted our audience to see the level of science that's gone into
Yeah,
this.
maybe I can just illustrate a little bit. Well, how do we
Yeah.
test? How do we test which polysaccharides are functional, for instance? So
Sure.
when I go to this slide, so this is some of the experiments that we have been doing to test if the polysaccharides really help you to repair your glycocalyx. So what this is a small blood vessel, what we call a venule, that takes the blood from the microvasculature back to the heart. And those vessels are very important also for inflammatory responses. A lot of the immune cells will stick to the wall of these kind of vessels and then
Mhm.
see if there's an issue. So in this setting, we did damage glycocalyx before. So if you look closely, you see on the other side here, with the flowing blood, these little larger cells, a little bit transparent, moving slowly over the vessel wall. So those are leukocytes that try to stick to the wall. And in an attempt to repair glycocalyx, we put a little microneedle inside this vessel, just on the top of the screen outside the field of view. And every few seconds, we can inject small amounts of fluid. And this time we added polysaccharides like fucoidin into the fluid and put a dye label on the fucoidin polysaccharide. So the light dye that we're injecting is actually fucoidin molecules that we inject into the blood and then actually treating this left side of the vessel. We realized that by the small amount of fucoidin that we inject, it only is exposing the left side of the vessel wall, doesn't get to
Yep.
the other side. But if you do that, within a minute, you'll find a bright fluorescent lining of new glycocalyx on the inside of the vessel wall. So when we zoom in a little bit, so you see here, this is black. The black line is the vessel wall endothelium. And after a couple of minutes of injecting the fucoidin, there's a very thick new coating of a couple of microns thick fucoidin-based glycocalyx that's mechanically stable and it's very thick compared to the adhesion molecules presented by inflammatory
Wow.
challenges on the endothelium,
So
and it's
this is a
actually perfectly
patch.
able to
Yeah.
mechanically prevent inflammatory cells to stick to the wall.
What's interesting is this was 10 years before the first product, arterisol, came out.
Yeah, so we have been working on this already for years. So these
Yeah.
tools really helped us to test different polysaccharides. And then, for instance, we measure how many leukocytes are sticking to the wall causing local inflammation. So this is just an example of such a challenge. If we damage glycocalyx either by risk factors like cholesterol or more specifically with an enzyme called hyaluronidase, which breaks down those hyaluronic acid glycosaminoglycans, and you count on the vertical axis how many inflammatory cells will stick to the vessel wall causing inflammation. So
Yep.
the red bars show if you don't treat your glycocalyx properly, then within half an hour, you can have like a threefold increase in inflammatory cells sticking to the wall. So the
Wow.
wall gets very sticky, and it's good when it's needed. But if your glycocalyx is just being challenged by risk factors like smoking or diabetes, you don't want this kind of inflammation in your
No.
vessels. So adding a supplement like Revasca to your diet and having increased levels of these polysaccharides circulating in the blood, continuously checking and repairing your glycocalyx, then even in the presence of a challenge, then it's still perfectly able to rebuild your glycocalyx and
Yeah.
prevent all these inflammatory cells to start sticking to your wall and causing all kinds of inflammatory problems. So yeah, so these tools are very powerful to help you, repair your glycocalyx and prevent all kinds of problems with inflammation or coagulation or loss of nitric oxide production. So yeah, it has been a fun journey to be on the last 10, 15 years with Bob Long and optimizing the supplements. And I think this is the best
Well-
supplement so far that we ever developed.
Well, your research started in the late 80s, and your research built on research that started, I think you said, in the early 70s is when it first started on this.
Yeah, so this has been going on. So I'm almost 40 years working on this one topic,
Yeah.
getting interested, finding some evidence of glycocalyx, see that it's hugely important to keep your vessels healthy, translating that into a tool that we can use in humans and clinical studies and in, preventative doctors' offices. Within minutes, now we can assess your vascular health and how your glycocalyx is doing, and check if the therapeutic that you're taking to improve your health is really functional. So that's not just
Right.
a hearsay. So you can measure, very quantitatively how healthy your microvascular and your glycocalyx is, and if Revasca is really working for you.
Now, the point I was just making was that this bottle of Revasca that was shown on the graphic earlier is really the result of 55 years of research almost, and result of your 40 years of research. It didn't just happen. This isn't a guesswork. I mean, these
No,
are
and
done from
it's an
clinical.
ongoing story. So, right
Right.
now, and I was kind of surprised how open-armed we are welcomed by the academic community to test supplements like Revasca in all kinds of clinical trials.
Right.
For many patients, there's nothing else. There's nothing available to start prepare the vascular system and try to mitigate all kinds of loss of
Right.
function in different organs. So we are in over 10 clinical trials right now, full-blown clinical trials, using a dietary supplement to test in all kinds of patient groups if we can improve their health. And so far, everything looks very positive.
Yeah, and historically, you've had about about a dozen studies in the past, because I mean, there's hundreds on the GlycoCheck device. The studies are now starting to pile up on the Revasca.
Yes.
And so far they're all confirming that when you
They're all
use
confirming that we are able to rebuild your glycocalyx. And if
Right.
we do rebuild your glycocalyx, all kinds of functions associated with glycocalyx are restored. So you produce more nitric oxide. You're better able to control blood pressure. Your vascular wall stiffness reduces. So it's also like an anti-aging therapeutic that helps you to make your blood vessels more flexible. It also helps you to control your blood pressure. It helps you to protect against all kinds of challenges, like with COVID, for instance, the COVID, the toxins in stored. So all kinds of studies ongoing, all very positive.
Yeah, well, and the other thing too is just lifestyle alone won't do it, because I mean, I'm a good example. I own a lifestyle medicine company. I'm one of these 1%ers who, when a doctor says I need you to do these 8 things, I do them, and I do them 7 days a week. And I've done that since 2019, and yet I had not a really very good score, and I had actually some significant damage. That PBR score that you showed 2.1, mine was 2.64 when it started. And Revasca has improved that already significantly, and brought my microvascular score up and my damage score down. And so just lifestyle alone
No, and that doesn't mean people should not pay attention to
shouldn't do
lifestyle,
it.
but
Right.
we were also in a study on the impact of different exercise protocols on your vascular health and your glycocalyx. So there was a study on high intensity interval training. And the interesting thing is that some people, even after the first exercise bout, they have an increased level of some epigenetic markers that respond to exercise. And those markers actually also control very strongly with improvement of microvascular health and glycocalyx.
Right.
But not all the people doing the same exercise show that response.
Right.
Some people, for some reason, genetically respond very well to exercise and can repair the glycocalyx, but some others don't. So you need something on top of regular exercise to make sure you do
Right.
improve your microvascular health.
Well, this test was actually the canary in the coal mine for me because I went through the medical system and they measured the 1%, which is the big, large arteries. What we measure is the 99%, which is the microvasculature. My 1% was just fine. But the score said your 99% is not just fine. And so it caused me to go digging. And I went and got like a next generation cardio test. It's called an MCG. And what we found is I have microcapillary blockage. It's rare for white males. It's only 15% of white European of descent males have micro and not macro, but 49% of women do. And people of color have a lot higher levels of microvasculature blockage. The other thing, though, that's really cool about this device is the measurement is that it picks it up early and you can do something about reversing it. And what the doctor told me that where I got this advanced measure said that if you have microvasculature blockage, it can migrate very quickly into the major vessels. And so you think you're fine, and then a very short amount of time, it can just migrate into there. And so, the good news for me, the other thing I learned from me, Hans, is I have this genetic marker called MTHFR. About half the public has it. And what that does is that you don't make the buildup. There's a missing link in this chain. And so I don't make nitric oxide, serotonin, dopamine, norepinephrine, or melatonin at all after age 50. And so so this device helped me go look, and I learned all of this. And now I'm getting treated with methylfolate to replace that missing thing. And now nitric oxide's firing, serotonin's firing, everything's firing. And I'm also, but the doctor said, you absolutely have to take a double dose of Revasca. He said that with what I'm giving you with good lifestyle will completely reverse this, and you'll have lower risk than 99% of the population in 18 months.
Well, the good thing is you found out in time, huh? So you have time enough to do something about it.
Exactly. Yeah. And that's the opportunity here. And so there was one other thing I was going to ask you, and I'm trying to think of what it was. I can't think of it right now. Is there so one thing that Bob said, and I want to reinforce is there's not a lot of GlycoChecks distributed around the world right now. We're starting to do that. There's nothing that's stopping anybody from just going ahead and getting on the supplement because it really is foundational. And what would you say, Hans, that if the glycocalyx is compromised in someone, in some ways they're wasting money on other supplements until they address this?
Well, the only way any supplement or any drug will get where it needs to go in any organ, any cell, you need a healthy microvasculature first. So, if you don't have a healthy microvasculature, and we did see already at early stages, even healthy people exposed to risk, like in a big obesity study that we did. So these people, were completely healthy and they wouldn't get any obvious organ complications for the next 5 or 10 years. But even these people exposed to risk, some of them show more than 50% loss of their microvasculature. So they're missing a lot of their capillaries, and micro sections of organs don't get the nutrients that they need. So you can have the best nutrients in the world, but if you don't have your microvasculature in place, it doesn't get to those sites at risk. So you need to repair your microvasculature first. That's key before you can actually expect other nutrients to get to the places where they need to go.
Wow, that's powerful. Well, the way you find this is to go to glycocalyx.com, and it's GlycoCalyx.com. It's not an easy word to spell, but it'll be in all of the show notes.
You can see it in my background here too.
Yeah, kind of. You have to duck to get the whole picture, but yeah. But Dr. Hans, I don't know if people really understand. They have been listening to the person who was on the leading front of discovering this and bringing it to the world. And millions of people are going to benefit from this. And we're grateful for all the work you've dedicated your life to. Thank you for being on this.
Well, it has been a great journey and looking forward to all the stuff that we can still do together, Steve.
Okay, thank you.
Thank you.
Steve Adams here from Tiger Health Assessment, talking about the True Health Assessment. What if you could safeguard not just your health, but the well-being of your entire family? With the True Health Assessment from Tiger Health, you can. Our comprehensive blood screening identifies hidden risk before they become major issues. Our elite team of Mayo Clinic trained and naturopathic physicians then create a customized plan to optimize your health for years to come. When you prioritize your wellness, you ensure you can be fully present for the people you love most. Don't let preventable issues cut that time short. For less than the cost of a daily latte, you can gain peace of mind and a clear path to sustained vitality. Protect your future and your family's future with True Health Assessment from Tiger Health at thetruehealthassessment.com. Again, that's at thetruehealthassessment.com.